What can be done at this time to remedy my neck? 4 months ago, my lower facelift was beautiful, and now the skin is loosening around my neck. Wasn't it tightened sufficiently? I asked my surgeon yesterday about this, and he briefly responded by saying that it's okay, and that it looks natural. I feel that it should look better. What should I do about this? Do I need a second opinion, or should my doctor be obligated to make me happy with the results?
Thank you for your question. You submitted a question with photos of you smiling, and you stated in your question that 4 months ago you were quite happy with your procedure and that now your neck is starting to loosen. And your physician who you visited said it was okay and it looks natural. So you're asking this question about whether or not the doctor should do some more tightening. So let's understand, first of all, the process of your procedure and where you're at now. First, when we do face and neck lifting, there is a balance as to how much we want to be able to tighten the sagging skin and the muscle. And most importantly, we don't want to create excess tension. If you have ever looked at people who have had facelifts where the scars don't look so good, sometimes those scars are stretched. And a lot of times this happens in some of those mini lift procedures which too much skin is removed and not enough deeper work is done. So they try to pull the skin as tight as they can, and the skin tends to widen and stretch. That happens because there's a balance. Your skin elasticity will give a certain amount and will stretch a certain amount. And in addition, when you have this procedure done, soon afterwards, there's always a little bit of swelling. And as we get older, the skin that was once thicker from the dermis or the backbone of the skin, as well as the fatty layer under the skin, tends to get thinner. So interestingly, a lot of times people look a little bit better when there's a little swelling. We want to differentiate, when you ask this question, between skin quantity versus skin quality. I always explain to my patients that when I do the surgery and I tighten the skin and I resect or trim and I tighten and I do everything to make things look really good, we're really doing this in a position where you would be in a social position, where you look straight on at a person across from you when you're talking to them at lunch, etc. When you bring your chin down, you're going to get a little bit of wrinkling. If the procedure is done well and things are tight, then it's really about skin quality. So differentiate quantity of skin versus quality of skin. A certain percentage of patients will have significant regression where the skin will stretch. Every time you turn your head, you are stretching the skin. Every time you bring your chin up, you can be stretching the skin. So at times we will do enhancements to try to maximize the improvement of the neck and jawline. But we always try to make sure that we're dealing with differentiating quantity versus quality. Sometimes the face descends a little bit and then the skin collects under the chin. So then maybe a little bit more aggressive lifting is necessary. It is a little early to be able to tell that at 4 months. So I think that continuously meeting with your doctor and assessing with your doctor what is quantity versus quality of skin. Quantity of skin enhancements may be appropriate. If it's skin quality, it's not something that is typically a surgical procedure. In our practice, we actually enhance skin quality with procedures such as the injection of platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it is a concentration of the healing factors related to when you get a cut, and the platelets and the serum have these growth factors that stimulate healing. what we've been able to do is with this method, we actually improve skin quality. That includes the backbone of the skin, the dermis with collagen, blood supply to the skin so the skin looks healthier, and even the fatty layer of the skin will improve, and that's been shown in studies with biopsies. So skin quality may be something that you think about moving forward. But again, look at your before pictures and have a kind of a sense of what is realistic, and then make a determination if this discussion goes on to 6 months or a year and you feel like you want to keep pulling back, and if the surgeon feels that they can really get something done, then you might be a candidate at that time. So I just wanted to at least help you understand that early on after the surgery, swelling can make the skin look better. In addition, skin quality should be differentiated from skin quantity. And as long as you have a good rapport with your doctor, I'm sure your doctor will be interested in making sure that you get the best result you possibly can. So I hope that was helpful. I wish you the best of luck, and thank you for your question.